present.
Lung cancer continues to be one of the most common cancers worldwide, claiming more lives yearly than breast, colon, and prostate cancers combined. Now, as we recognize World Lung Cancer Day, which was back on August 1st, our medical contributor, Dr. Ogechika Alozie with Sunset West Health, is here with what you need to know about lung cancer. All right, Dr. Alozie, how many Americans die from lung cancer every year?
I think the short answer is a lot. And you sort of led into it in the beginning that we talk a lot about colon cancer, we talk a lot about breast cancer, but lung cancer is the leading cause of cancer deaths worldwide. So about 130,000 American lives are lost. It's 1 in 16 people, 1 in 15 men, 1 in 17 women. It's actually 3 times as likely to kill men as prostate cancer and 3 times as likely to kill women as breast cancer, unfortunately.
However, the number of diagnoses are declining.
So this is really exciting news. If you look at a 10-year period between 2009 and 2018, the incidence rate actually went down by 3%. Might not seem like a lot, but that's thousands of deaths a year. The lung cancer deaths have actually been cut in half for men and cut in a third for women. I want to focus in on this a little bit because it's really important. One of the pieces is that people are smoking less.
Yes.
Right? And so we don't have the data for what vaping is going to do to that, but we know historically people have smoked less since the early 2000s and actually the 90s. The other thing, and this graph really illustrates it, is there's a lot more therapies and there's a lot more therapeutics, and we're also going to talk about something else which is really important in terms of getting ahead of this.
All right, now what are the risk factors for lung cancer?
And the number one thing is smoking. Right? Whether it's primary smoking, that's your smoking, cigarettes, cigars, vape pens, marijuana, all things smoke can lead to lung cancer. Radon, we don't talk about it a lot, but in some certain industries they have that. Asbestos, I had to tell a story that once upon a time I wanted to buy a house in Kern. The reason I didn't pick up 2 houses because they had asbestos in their basements and I didn't want to go through the abatement process. And those that work in chemical industries. Things you can't control, some people just have genetics. I actually lost a friend recently, 43 years old, never smoked in his life, but died of lung cancer. And then obviously radiation and air pollution.
All right, and just like with every other cancer, doctor, early detection can save a life.
Now this is huge, and this is one of the reasons why the diagnoses have gone down, but actually it's the real reason that the deaths have gone down. If you pick this up, and there is a good screening test, it's called a low-dose CT, computed tomography test, can actually detect lung cancer early. The unfortunate thing, and this is partially education, partially insurance, is that majority of the people that meet the screening criteria, 7 out of 8, don't actually get it. And so if you're an adult between the ages of 55 and 80, if you've ever had a high smoking history, heavy smoking history, or if you currently smoke now or have quit within the last 15 years, it's a conversation that you need to have with your clinician.
And even if you've been exposed to secondhand smoke, that's a good idea.
Absolutely.
Now, we do want people to pay attention to the symptoms.
Yeah, so the warning signs, if you ever cough up or spit up blood, that's an immediate warning sign, right? We don't talk enough about recurring respiratory infections, but if you're getting a cold or a pneumonia multiple times a year, need to have a conversation, right? Cough that's new or different, you're always coughing in the morning, that can be the beginning of chronic obstructive pulmonary disease or COPD, and then back pain, shoulder pain, that can be a sign that your lungs are tightening up, trouble breathing, actually wheezing, and just being exhausted, right? Part of it is we never sleep enough, but part of it is it could be a sign of lung cancer.
And let's take a look at some of the local resources that are available to folks. Of course, we talk about the Rio Grande Cancer Foundation, the Rio Grande Cancer Specialist, Texas Oncology.
Huge.
All of these organizations are there to help with diagnoses and help people combat this. And of course, you know, Texas Tech Health Sciences Center just got this $25 million gift from the Fox family to set up a cancer center here in El Paso, which will be great.
Yeah, I think that's super exciting. Again, all these organizations and a host that we can never fit on the screen, right? They're all doing this screening, a bunch of radiological centers. But the fact that that donation will build a cancer center that's focused in El Paso, you don't have to go to Mayo, you don't have to go to MD Anderson. For me and for that, our community, that's huge.
That is. ABC 7 medical contributor Dr. Ogechika Alozie, thank you, sir.
Thank you, sir.